Good afternoon. Today I will be presenting on the person and the paraprofessional, that person being myself. During the presentation, I will be going over motivating factors behind values, biases, and influences, as well as diving deeper into what makes up values, biases, and influences, and lastly, reflecting on my personal values and biases identified that may be present as I continue a career in behavioral health. So to understand how values motivate, we need to look at what values do. Firstly, values shape long-term goals and reflect what is important in an individual's life. They're critical in understanding morality and ethics because they shape an individual's identity and guide how they act with others. They're considered trans-situational and can influence how they act in ethical dilemmas. Despite an ethics code, different values in different cultures may ultimately act differently based on their core values as motivators in a situation. So diving deeper into values, it's important to note that when a goal is accomplished that aligns with an individual's value or values, the brain releases dopamine. So when tasks are accomplished adhering to an individual's values, the body finds inner peace. And on the contrary, when goals are not achieved using those values or the values are surrendered in order to make something happen, the mind and body can become distressed. Values are the link and guide for accomplishing long-term goals in a way that satisfies our foundational beliefs and thought processes, linking our future to our perception of past events and environments. Looking at values from a clinical setting, they can impact both the patient and the provider during the treatment process. Patient values can impact what types of care they consider and are willing to participate in. Cultural and religious views become important when considering specific life-saving measures and end-of-life care. Depending on how a patient considers personal values, they may conflict with provider treatment plans and exercise autonomy in refusing procedures in favor of their values. This can become a difficult situation for the provider to balance their personal values and the patient's and to come to a compromise that works in the best case scenario for the patient's health and making sure that the best treatment is provided for that health. Now that we understand values, we can look at how those values can produce certain biases. Studies have concluded that individuals are more susceptible to cognitive biases when information aligns with their values. This underlines the importance of remaining aware of personal values and understanding how these values can influence information being received, consequently changing the outcome from neutral to some form of bias. Here we can see the two primary ways that values and the consequent biases can influence treatment. So transference and countertransference were developed and defined by psychologists Freud and Brouwer in 1895. Transference and countertransference are often considered unhealthy in counseling. These effects can be mitigated by remaining self-aware and reflecting on boundaries with colleagues and supervisors. The provider's responsibility for identifying and removing these occurrences and creating a healthy relationship with these influences can be discussed and addressed. Countertransference is often described as a result of incomplete training of the analyst. Identified on the screen are what I consider to be my personal values. The four main pillars of my values include religion, family, my Army values, and culture. My religious values dictate how I view life, deal with large issues, and interact with others. I have a profound understanding of my place and purpose motivating me through issues as they occur. My family values influence how I view familial relationships and responsibilities and how family structure should interact and behave within the family unit. The Army values, which I grew up on as I got older, shaped how I view work and interpersonal responsibilities. They influence how I see relationships that extend into the professional setting and how I act as a citizen within my community. My culture influences how I interact with others and what I view as acceptable behavior due to how I was raised in the environment I spent most of my life. Based off my values, I've identified primarily two biases that I would be most susceptible to committing. countertransference, and optimism bias. These three sources of biases come from the core of my values. I am deeply religious, working towards becoming a pastor. My view on religion goes farther than most, and restraining that value in patient treatment is critical to my success in behavioral health. The way I was raised in both my culture and family dictates how I see relationships and responsibilities within the family unit and beyond. Controlling my viewpoint and resisting countertransference will be a focus of mine going forward. I want to get into behavioral health due to past traumas from my relationship, as well as experiences during my time in the Army. Although it is important to have strong motivators such as these that are personal, I must remember to compartmentalize my personal views and reasons and allow for fair and unbiased treatment to occur. As we conclude this presentation, I do think it's important to reflect. It's important to understand where values come from and what they're for, that they provide frameworks for us going forward to motivate how we navigate situations outside of morals and ethics. They provide a foundation for us in how we move forward in our lives. My values are very important to me. They define who I am and have motivated me to pursue a career in behavioral health to begin with. Being aware of my values is essential, but being able to control them and not push them onto others is what will separate me as a good counselor from one that is not as effective. Understanding bias and influence can aid in ensuring I provide ethically sound care that ultimately benefits the patient.